Well, a loss of a legend here, Anthony Mason, 6'7" forward for 6 different NBA teams over the years. He played for 13 years. Last 5 years was with the New York Knicks, and he actually took them to the 1994 NBA Finals with a super team. And he used to carve messages in his hair and stuff. He's kind of an interesting guy. He was diagnosed with congestive heart failure about a couple of weeks ago. He's 48 years old and dies of a congestive heart failure heart attack. There's 2 terrible bits of information here. Number one, he was a professional athlete for 13 years. When you take all athletes, all professional athletes, all different teams, football, basketball, soccer, baseball, boxing, etc., the average lifespan is 62. When you look at just football players, the average lifespan is 51. This came out in 2004, published statistics. And there's never been a professional athlete ever lived to be 100. Here's Anthony Mason, great NBA player, 13 years, dies at age 48. A couple of weeks after he dies, and also with congestive heart failure. I want you to get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book, Energy Crisis, okay, which goes into athletes and energy drinks and so forth, and the CD, Dead Athletes Don't Lie. What a great CD. We sell a lot of them because people who, you just even work out in the gym, you need to listen to Dead Athletes Don't Lie, and understand why athletes die so early, why none of them live to be 100. That's because they're sweating out nutrients. They drink expensive water to rehydrate, which is not a bad thing, but they're sweating out a soup that contains all the nutrients found floating around in your blood. So if you only have 65 nutrients, you're going to have 65 nutrients in your sweat. If you have 75 or 85 or 90, you're going to have that many nutrients in your sweat. If you're just drinking water, it doesn't take long for the high-end players who play the most and exercise the most and train the most, sweat the most, die early, break down in joints and so forth. Well, we came up with a sports drink, okay, called Rebound. It has 100 nutrients for Theo Ratliff of the Atlanta Hawks originally. And he's 28 years old. He had bone-to-bone arthritis both knees, cartilage pops off his right hip, fractures a wrist catching a pass from a team player, and the orthopedic surgeons for the Hawks just said, look, this guy's too fragile to play pro ball. So we rebuilt him. We rebuilt him with the Healthy Bone and Joint Pack. We're able to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, bones, fractures, discs between the vertebrae. And Theo had a 14-year career and made over $140 million in contracts after the orthopedic surgeon said his career was over. We invented the Rebound for him, and athletes, whether amateur, Olympic, or professional, love the Rebound because it has 100 nutrients in it. Gatorade has 2, and Powerade has 6. Rebound has 100, 78 minerals, 60 of which are known to be essential. And so you really got to go in that direction. And, of course, the book Epigenetics goes into why athletes die, not genetics and so forth. And then, of course, the book Energy Crisis compares our sports drinks and energy drinks like Pollen Burst with all the other ones in the market and goes into how you extract energy from sugar and carbohydrates and proteins and fats. There's a CD that goes along with it also, Energy Crisis. And a great gift for anybody who is playing athletics is give them the Healthy Athletic Pack. The Healthy Athletic Pack. You need to lose some weight, throw in the ASAP. We've had people lose 140 pounds in 100 days. It's not unusual to lose anywhere from a half a pound to 2 pounds a day. And the magic of all this is you'll never gain the weight back as long as you don't get off your 90 for Life program. Well, Anthony Mason died of congestive heart failure, which is a deficiency of a single vitamin. We've known it for 300 years. Here's this top athlete dies of a simple deficiency of a single vitamin. Okay, and what I'd have done with him is give him the Healthy Athletic Pack, make sure he's drinking Rebound instead of anything else. I'd give him also the de-stress capsules, which has mega doses of that one vitamin. Well, we've actually been able to help people get off their heart transplant list with congestive heart failure, some of them as quickly as 5 days. Their cardiologist took them off of the list, of the heart transplant list, not me, okay, because of such dramatic effects. You know, you have an iron deficiency, are you going to get a bone marrow transplant or an iron supplement? You have to think about that when a doctor offers you something when you're an athlete and you have a knee problem. Don't let them put in an artificial knee. Don't do arthroscopic surgery. Get on the healthy bone and joint pack and support and promote healthy maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. Bone makes bone cell. And certainly our hearts go out to Anthony Mason's family. As I know he's got a younger son who's also playing basketball at university level right now. And his son should be taking the healthy athletic pack, the Rebound, and I would throw in some extra selenium to prevent cardiomyopathy, heart disease, and I would also throw in the de-stress capsules to reduce the risk of and prevent congestive heart failure. Nobody should die of these types of heart disease. They have nothing to do with cholesterol. Cholesterol does not cause anybody to die of anything. It's the old medical theory. And again, thank you to Anthony Mason and all his great years in the NBA. Well, stick with us. We'll be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, I thought we'd talk a bit about these superbugs. Recall just recently there was several deaths and infections down at UCLA's hospital, and apparently this isn't the first time this has occurred. It also occurred in Illinois a few years ago. And apparently, according to this CNN story, FDA may have been aware of this for a while. According to this story, headlined Scope Superbug, how long did the FDA know about the problem? And you talk about a specific gastroenterologist, Dr. John Allen. He had 10 patients came down with the exact type of rare bacterial infection. He rushed to find the source of the lethal superbug. Turned out it was in his own office, a device called a duodenoscope, used to check out the tiny ducts in the intestinal tract. The Pseudomonas bacteria evaded standard cleaning process, and it infected one patient after another. These duodenoscopes were also the cause of recent infections at UCLA, and they say that Allen's patients in Minnesota were infected in 1987. So nearly 30 years ago. They say now doctors in Congress say they're concerned that the Food and Drug Administration missed the problem for decades. According to Allen, who is the president of the American Gastroenterological Association, says this problem has been known since at least 1987. It's certainly disturbing that a fundamental design issue with these scopes would cause problems for this long. FDA had issued advice to hospitals that in addition to following the manufacturer's cleaning instructions, they should, quote, meticulously clean by hand the specific portion of the device that is believed to harbor the bacteria. FDA spokeswoman Leslie Wooldridge says this is the first time the FDA communicated such advice for duodenoscopes. And according to Dr. William Mazel, Deputy Director and Science and Chief Scientist at the FDA Centers for Devices and Radiology, said it wasn't until 2013 that there was convincing evidence that the duodenoscopes could harbor antibiotic-resistant infections, even when the manufacturer's cleaning instructions were followed properly. Over the years, the FDA received dozens of reports about the infections with duodenoscopes. And according to this, Dr. William Mazel says, we received 1 million adverse reports on various devices each year, and we evaluate those reports based on the information provided. But they say outside the FDA, there was a significant concern before 2013 that these scopes and a small mechanism called the elevator wire were difficult, if not impossible, to clean thoroughly. 2010, a safety expert, Lawrence Muscarella, published an article in the journal Endoscopy calling for special attention to the elevator wire. And in 2011, a consortium of medical societies warned that the automatic cleaning processes didn't always effectively disinfect the scopes. So there you go, Doc. FDA, in their infinite wisdom, have been aware of this for nearly 30 years, and they waited until all these deaths before actually doing anything about it. And did they pull it off the market? No. They just said, clean it a little better.
Yeah, well, this amounts to some 15,000 seniors killed every month in America in hospitals who go in unnecessarily for these tests because Granny is 80 years old and she's going to do whatever the doctor says. He said, I'm going to put you in for some tests. You're 80 years old now. Let's just check and make sure you don't have anything going on. Nothing wrong with her. She's doing fine. Bowling with her girlfriend, right? So he sends her to the hospital, and within 2 days she's dead from a belly infection or lung infection from one of these bugs because they puncture something, just like Andy Rooney from 60 Minutes. Okay, they killed him with one of these scopes. And that amounts to 180,000 seniors are killed each year from being put into the hospital to have these tests done. 180,000 Americans each year. If Iran and North Korea were to do that, we'd declare war on them. Well, we'll be back after these messages. Okay, Doug, let's go to callers.
All right, let's head to Maryland. And Carmen, you're on with Dr. Wallach.
Oh, Carmen, you're on the air.
Hi. I known this girl for about 2 years, but I didn't know what was wrong with her. And she says her mother said she has schizophrenia, but she does not hallucinate or hear voices. But she said she was diagnosed when she was in her teens to early 20s with multiple personality disorder. And I've been giving her pollen bursts, but I didn't know if there's anything we can do to help her.
Okay. Anytime anybody has things like schizophrenia and psychoses, which is where you usually hear voices, is psychoses rather than schizophrenia. And then we're talking about depression, manic depression, bipolar disease, ADD, ADHD, autism, anxiety attacks, panic attacks, any of these things. If you ask a psychologist or a psychiatrist what causes these diseases, they're all going to say a chemical imbalance. They proceed to give them chemicals, prescription drugs. Well, really, what they need is nutrition. The brain requires 90 essential nutrients, 16 minerals, 16 vitamins, 12 essential amino acids, 3 fatty acids. And I like to say 4 now because I'm going to put cholesterol in as an essential lipid. Cholesterol is an essential lipid. And basically, how much does this lady weigh?
Maybe 140, 150.
Okay. So she's right at that cusp. When you have these kind of problems, certainly if she's on prescription medication, do not take her off the prescription medication. Let her doctors do that. And what I would do is get her off all the bad stuff. Absolutely no fried foods. No deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky. None of the processed meats with nitrates, nitrites. No oils. That means no olive oil, no coconut oil, no margarine, no mayonnaise, no salad dressings, no cooking oils, and absolutely no gluten, no wheat, barley, rye, oats, so they can maximize the absorption of nutrients. Then at 140 pounds, I would give her 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. And for drinking, I'd have her use the non-carbonated Rebound, which comes in sticks or in a canister. You can make it up by putting it in water. The Rebound has 100 nutrients in it. And then I would also throw in the de-stress capsules, have her take 3 of those twice a day. That's 2 bottles a month. That's for the metabolism of the brain itself. And then I would also throw in the Smart FX, 3 of those twice a day. That's 2 bottles a month. And that's for making neurotransmitters, raw material for the brain to make neurotransmitters for memory, cognition, problem solving, including socializations, situations, and so forth. And no sugar, natural or processed, no sugar. Now, there's things like stevia, great herb. It was very sweet, no calories. And then there's sucralose. A lot of people have a thing about sucralose, but actually it's a fraction out of molasses. Molasses is kind of like crude oil. It has all this stuff in it. And sucralose is a very high-end sweetener. You can't absorb. There's no calories associated with it. Okay? And call me every couple of weeks. Let me know how she's doing. And let's see here. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. If you'd like to talk to Dr. Wallach, we do have some open lines. Call the priority line, 831-685-1080. That's 831-685-1080. Lines open.
Okay, Doug, let's go to callers.
Let's head to Indianapolis, Indiana. And Alan, you're on with Dr. Wallach.
Well, Alan, you're on the...
Okay, sorry. I'm on there.
Right. Yes, sir.
So I have first let me start with a question. I have the Beyond Tangy Tangerine 2.0, and I was going to ask you for my specific needs, obviously I'm nutrient deficient. It says 2 scoops in water per 100 pounds. I'm 150 pounds, so I was going to do 3 scoops, obviously. But it says 1 to 2 times daily. If I'm physically active, like quite a bit, do you recommend I do 3 scoops in the morning and 3 scoops for dinner, for example, or how would I do that?
Okay, well, do you have any health challenges, or you just want to take it to prevent stuff?
No, I mean, I know I'm not really that bad, but yeah, I have some nutrient deficiencies, maybe a little bit of anxiety or overthinking and a few symptoms here and there that I'm just going to assume that are nutrient deficiencies. Plus, I'm physically active.
Okay, well, two things need to happen here. Number one, stop the ongoing damage. Number two, support maintenance repair. So no fried foods, no processed meats, no oils, no margarines, right? No olive oil, coconut oil, cooking oils, salad dressings. And then certainly no gluten, no wheat, butter, rye, oats, maximize absorption. All those bad things got to go away. And then you need to take more than just the BTT, Beyond Tangerine 2.0. You need a minimum of the Healthy Start Pack, which is the OsteoFX Plus, the Beyond Tangerine, and the EFA Pluses. That would be a minimum. Just don't take the BTT because you're going to be short certain essential nutrients, okay? And some of the major minerals, and also as well as the omega-3s. The BTT is meant to be a core supply of vitamins, amino acids, and trace minerals to the 90 essential nutrients. But you still need to add the OsteoFX Plus and the EFA Pluses, which are the omega-3, 6s, and 9s in proper ratio. At 200 pounds, what I would do, to your concerns, is take two of the Healthy Brain and Heart Pack because of your emotional stuff. And that would mean 3 of the selenium capsules twice a day, 1 ounce of the OsteoFX Plus twice a day, 2 scoops of the Tangerine 2.0 2 times a day, 3 of the EFA Pluses twice a day, and 3 of the EFAs twice a day. All that will be accomplished by the 2 Healthy Brain and Heart Packs per month. Then I would use the Rebound as a nutrient replacer in sports drink anytime you're going to sweat, or just replace your soft drinks, even the diet ones, with it, because it has 100 nutrients in it. In our sports drink, it has 100 nutrients. Gatorade has 2, Powerade has 6. And then, let's see here. Wouldn't hurt also to throw in the Immortalium to help your brain grow a little bit. Okay? 3 of those twice a day, 2 bottles a month. We'll be back after these messages.
Well, let's head to Connecticut. And Nancy, you're on with Dr. Wallach.
Oh, Nancy, you're on the air.
Hi, I wanted to get some information on what can be done for kidney failure. I've seen you on Benny Hinn, and so I wanted to know, because I've been told that I have to go on dialysis.
Is this for yourself or someone else?
It's for myself.
Okay. How long have you been on kidney dialysis?
I just started briefly. I did it for a day, and then I stopped. So I'm not on dialysis right now, but they want me to get on dialysis as soon as possible because my creatinine is really high.
Okay. Do you have diabetes?
No, I do not have any other health issues.
No high blood pressure? No high blood pressure?
High blood pressure, and the kidney issues were diagnosed at the same time. And prior to that, I had hypothyroidism, and I've had that for about 15 years.
Is that hypo, low thyroid?
Yes.
Okay. All right. Now, this is a Shar thing here. Shar, are you there?
I'm here.
Okay, kiddo. What would you do for somebody, and what do you weigh, Nancy?
Right now, I'm like 145 pounds.
Okay, 145 pounds. All right. And no other issues, no skin problems, no eczema, dermatitis, no asthma, no constipation, diarrhea?
Just the hypothyroidism and high blood pressure with kidney disease.
Gotcha. Okay. Let me get you going here because we only have a few moments. Okay, Shar, what would you do for this nice lady, Nancy, who weighs 145 pounds? She has a kidney failure. They want her to get on dialysis immediately. Do you know what your Nancy, do you know what your creatinine level is?
Right now it's like 13.
13, okay, that's high. Yeah. Okay. Okay, and so, yeah, we want to get it down below 1. We want to like 0.9 or 0.82 or something like that. All right? So what would you do for this lady? She has high blood pressure and kidney failure and low thyroid. What would you do for her?
I would give her a healthy brain and heart pack and add the Ultimate Daily for the kidney issue and add the Ocean's Gold for the thyroid issue. And she
Excellent. Very good.
She should get on a gluten-free diet anyway, and no cruciferous vegetables.
Okay. Very good. Okay, as Charles said, no cruciferous vegetable. That means no cabbage, broccoli, cauliflower, Brussels sprouts, or kale because they interfere with thyroid function. That may be your favorite, maybe why you've had low thyroid for so many years. And then, again, to prevent more damage to your arteries and your kidneys, and usually it's when you have kidney failure, there's nothing wrong with your kidneys. Not 100% of the time, but almost 100% of the time, there's nothing wrong with your kidney. And the reason why you have kidney failure is because the little microscopic arteries called afferent arteries that are carrying the dirty blood in the filtering units are plugged. And so what we're going to do is get the blood flowing through those little arteries. And Char is exactly right. At 145 pounds, I would start you out with one of the Healthy Brain and Heart packs per month. I want to go to 2, but I want your creatinine to come down a little bit before we go to 2. So one Healthy Brain and Heart pack per month, an extra bottle of selenium, so you can take 3 of those twice a day and a half a dose of everything else twice a day. And then for the high blood pressure, as Char said, the ultimate daily tablet, so I would take 3 twice a day, 3 at breakfast, 3 at dinner. That's 1 bottle a month because it's a large bottle. And then again, as Char said, the Ocean's Gold, I'd go ahead and take 3 of those twice a day. It's 2 bottles a month. And that provides the thyroid gland with a lot of interesting things that it likes and needs. These come from sea vegetables, sea grasses, some kelp, nori, even sea cucumber, stuff like that. And this should get her going. And then they give us a call every couple of weeks, and certainly every time she goes in and gets the creatinine levels, we want to see if it's dropping or going up or staying the same or what, because saying that we're doing the right thing, the creatinine level should begin to drop. Okay, so call us every 2 weeks and certainly any time that you visit the doctor. Okay, let's see here. Doug, we have time to start another one?
Yes, we certainly do. Let's head to Montana. And Trina, you're on with Dr. Wallach.
Hello, Trina, you're on the air.
Hi, Doc. I want to find out, my niece has been diagnosed with a protein S deficiency, and I need to know what to do about that.
Okay, how is this manifesting itself in her, and how old is she?
Okay, she's about 35 years old. She just got through doing the whole runabout with blood clots, and she did the natto and the omega-3s, and what else did she do for that? Bromelain. She did for that. The blood clots are gone, but now the doctors are declaring that she has this protein S deficiency.
Okay, now, has she had a history of blood clots as a younger woman?
No.
Okay, well, I wouldn't be too much worried about that protein deficiency because she's 35 years old and just showed up. And so a lot of times doctors try to look at things. Oh, we got a problem here with genetics. It's certainly not a genetic problem.
Right.
It's an inborn metabolism. She does have one of these blood proteins. But you would think if that were the case, guess what? She should have had blood clotting problems when she was 3 years old and 5 years old and 10 years old and 20 years old and so on, not wait until 35. Okay? So make sure that she gets gluten-free. And what would you do for how much does she weigh, you think, here?
She probably weighs about 150.
Okay. Char, what would you do for this lady that has had a blood clot problem, and the doctors are declaring a protein deficiency, a specific kind of protein deficiency involved in blood clotting, which could be made by the liver, right? So what would you do? Make the liver happy and prevent more blood clots.
I would give her the Healthy Brain and Heart Pack, and I would also have her take that nightly essence at night so she never gets any more blood clots. Or she does.
Yeah, the nightly essence is a blend of enzymes, as you point out, Char, and one of them is nattokinase.
Yep.
And it'll certainly, nattokinase is legendary for dissolving blood clots. But 150 pounds, with this history, I'd go ahead and give her 2 of the Healthy Brain and Heart packs per month so you can have 3 selenium twice a day and a full dose of all the other products in the Healthy Brain and Heart packs twice a day, including the EFAs, because it has EFA pluses and EFAs, so she gets 3 EFAs twice a day and 3 of the EFA pluses twice a day. And this is going to go a long way towards preventing more blood clots. And, of course, that's one of my 8 lawsuits in federal court against the FDA, and we prevailed to insist we can say, without fear of retribution from the government, that you can reduce your risk of thrombotic stroke. blood clot in the brain. You can reduce your risk of coronary thrombosis, a blood clot in the coronary artery, pulmonary embolism, deep vein thrombosis, supplementing properly with omega-3s. And that's turned out to be a very, very good thing we did, because certainly the omega-3s are part of the 90 essential nutrients. And again, I'm thinking about going to 91, but I want to keep our logo 90 for life. And so we just have to say 90 for life plus or something like that, because I'm going to throw in cholesterol really is a essential lipid part for so many functions and does not cause any disease. We'll be back with more truth, justice, and the young Jimmy way, and Dead Doctors Don't Lie for these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Young Jimmy, 90 for Life Crusade. And Doug, let's go to callers.
Let's head to Capitola, California. And Kat, you're on with Dr. Wallach.
Hello, Kat, you're on the air. Hi.
How are you doing, Dr. Wallach?
Fine. How are we, Kat?
Good, thank you. Looking forward to seeing you this week in Santa Cruz, your discussion.
All right.
I have an 80-year-old neighbor lady. She's a retired RN. She had knee replacement surgery 6 weeks ago. She's having trouble with the incision draining and being infected.
What? They gave an 80-year-old lady double knee replacement?
Yes, double knee.
Okay, somebody needs to go to jail here.
I agree.
Okay, so now she has draining from the surgical wounds?
Yeah, tube. They put a tube in there, and it's still draining. It's infected, I believe.
Well, okay. Yeah, certainly somebody who's 80 years old is not a good candidate for any kind of surgery, let alone bone surgery, serious bone surgery. Okay. So basically, what we need to do here is, what does she weigh?
She weighs about 170.
Okay. Does she have any other issues other than the arthritis and osteoporosis?
Osteoporosis and back pain.
Okay. All right. Shar? And she weighs how much? 100 and what?
170.
170, okay. 170-pound lady, 80 years old, chronic arthritis and back pain and so forth, osteoporosis, had the 2 knee replacements, and she's got complications. What would you do for her?
She needs 2 bone and joint packs. And also for the infection and stuff, I would put colloidal silver on it, take the killer biotic, and
You're exactly right. As Shar says, 2 healthy bone and joint packs per month, 1 full dose of everything twice a day, except for the glucogel. She could take 15 of those a day, 5 at breakfast, lunch, and dinner. And basically, the goal here is to support bone growth so that it actually goes and binds onto that machine they put in her knees and keep it from moving around and maybe even fracturing her bones because she has osteoporosis. Also, because she has chronic infections, as Shar said, it wouldn't hurt to give her the killer biotic. I'd go ahead and give her 3 of those 3 times a day. It's 3 bottles a month. And they're designed to support the immune system when you have chronic infections. But also, 2 of those herbs actually have antimicrobial properties and can kill bugs. And then it would also, as Shar says, use the killer biotic, the colloidal silver, and I would go ahead and dilute it 1 dropper full in a couple ounces of water. And if she's having any washes being flushed into that tube to disinfect that knee, she could use the colloidal silver. Otherwise, she could spray the colloidal silver around the outside of the wound and on top of the wound. I wouldn't inject it up into there unless they're already injecting things up in there to flush that wound out. If they're not injecting anything into it, just use a spray with 1 dropper full of the colloidal silver and a couple ounces of water. Spray around the open wound, spray the tube, and also spray on top of the joint. A certain amount of that colloidal silver will be absorbed through the skin. And I think that's where we want to go for the infection, and also for an 80-year-old lady who's had double knee replacement. Somebody really needs to go to jail here. This is just awful. These are the sort of things why doctors kill 15,000 seniors in America over the age of 65 every month. It's 180,000 a year killed by these types of procedures and screening tests like colonoscopic exams in hospitals. It's absolutely outrageous that doctors get away with killing 180,000 seniors every year for unnecessary procedures. Okay? They should have given us 90 days to see if we couldn't help support and promote maintenance repair of that cartilage in her knees and the bones in her knees. We do this in people her age and older, much older, thousands of times a year. Well, thank you, Shar. Super job. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless